Good afternoon, early evening to those who have joined. We're going to give it another minute just so everyone can jump in and join us. So hang tight, please. Monica, I see you raised your hand. Did you want to, if you want any questions, go ahead and drop that in the chat box. And then to those who have joined, since I said this, we're just going to give another few seconds probably for others to jump on and join. So hang tight, please. Hola.
Hola todos. Hi, everyone.
All right. Leigh, what do you think? Should we get started? See the
Go for it.
All right. So welcome, everyone. Thank you so much for joining. Love it. Please do say hello and let us know where you're coming from. It's so fun to see people from all over the country and the world really joining us here today. Miami, fantastic. So we are here today to discuss what doctors don't discuss with you and why. During the webinar, our amazing speaker, Leigh, will be talking about how to gather resources you're looking for when living with epilepsy. Doctors are so wonderful. I mean, what could we do without them? But they don't always have the time to discuss ways to find daily support, whether it's physical, educational, social, or psychological. Today we have, as I mentioned, our amazing speaker, and we have the honor of having Leigh Schommer join us today. She's a bilingual licensed clinical social worker who has assisted those with epilepsy for over 10 years. Through her time as a case manager at nonprofits and medical clinics, Leigh has gained a lot of experience in navigating the system when it comes to gathering resources for those in need. She very much enjoys this line of work, simply because of the satisfaction that comes from helping others. Before we jump to the next slide, in addition to thanking you again, Leigh, really have a lot of people to thank for making this happen today. Epilepsy Foundation, Eastern Pennsylvania, Epilepsy Foundation, Los Angeles, which, by the way, hello, I'm Rebecca Hollowell. I'm the director of the Epilepsy Foundation, Los Angeles, Epilepsy Foundation, Colorado and Wyoming, Epilepsy Foundation, Minnesota, Charles Hutchinson. I might think I'm saying that right. No, I'm not. Am I Charlotte?
Hutchinson Foundation.
Yes, thank you. Oh, so sorry. I had a typo here in my notes. The Pediatric Epilepsy Surgery Alliance and it'sYourEpilepsy.com. So let's move on to the next slide. For those housekeeping that we all hear so much on Zoom, but that are so necessary. So your audio and video will be muted for the entirety of the webinar. We are recording it as well, just for future viewing, and that will actually be available on it'sYourEpilepsy.com. And you'll have the opportunity to ask questions. Go ahead and at any time while you have them on your head, drop them in the chat box, although I will not be getting to them until the end when Leigh has actually finished speaking. So with that, Leigh, thank you again. Take us away.
Thank you. Let's see. Let's go on to the next slide, please. And hello, everyone. Thank you for being here today. My name is Leigh. As Rebecca stated, I work for the Epilepsy Foundation of Colorado and Wyoming. I am also a social worker and a primary care clinic here in Colorado, and I also have epilepsy. So I do have a passion for all of this, for this community. Today, we're going to discuss how social workers can assist you with your healthcare needs. Social work has often had a stigma. There's been a stereotype about social work in the past, and now it's getting so much more common. And social workers, just like other people in the healthcare field, we're just people who want to help, and that's what we're here for. So let's get right into it. To start off, why go to a doctor's appointment? Most people don't like going to the doctors. I am one of them. I work in a medical clinic. I love working with doctors. They are wonderful people. I don't like being a patient. That's a fact. Most people don't like that, but it's important. You go to the doctor for illness prevention, for health concerns, when you have questions, when something new came up, what's going on, medication changes, all of that. One thing with going to the doctor, so let's think of a scenario. What if you're living your life, you're totally fine, you have your routine, and all of a sudden you have a seizure? Now what? No one in your family has ever had a seizure. What do I do? Oh my gosh. When that happens, typically if someone has a seizure for the first time, it's important to call 911 just because it's the first time, or if it's lasting a long time, they want to see what's going on. If it's just one seizure, they may send you to your primary care office, your primary care physician, to get checked out. They may say, okay, let's keep an eye on it. If someone has just one seizure, actually 1 in 10 people will have a seizure in their lifetime, so that's not that uncommon. You may be fine. They may send you to a neurologist if you have 2 seizures, and then we go from there. So with this slide, it says new diagnosis. Now what do I do? That's the scary part, thinking, okay, I have maybe this new medical condition. I am no longer going to a primary care doctor. I'm going to a specialist. What exactly do I ask him or ask her? When that happens, when you are referred to a neurologist or an epileptologist, there's a ton of questions going through your mind. I know that feeling all the way. With that, that's completely normal. It's really important to make a list of those questions and differentiate, break them out, break them into columns like we have on the slide. So on the left, you'll see medical questions. Start thinking about it. Okay, what are my seizure types? What's the seizure frequency? Meaning how often are these seizures happening? What's causing these seizures? What medications should I take? Should I take any other treatment types? Do I have to take meds? Do I really have to take 3 medications? What are the side effects of those medications? Safety, what do I do when I feel a seizure coming on? What does my family do? What does my school do? What does my employer do if I'm having a seizure? That's all medical. Those are normal questions. That's really important. Those are all perfect for the doctor. Go to the middle column, lifestyle questions. So driving, that's a very important and common topic with epilepsy. It's kind of a tricky topic. That is a question for the doctor in the sense that, am I able to drive now? Are my seizures, how will my seizures affect my driving? That is a medical question. At the same time, that's a question that you can refer to a social worker. If the doctor says, well, we want to hold off on you driving for a few months, gosh, okay, well, how the heck am I supposed to get around? Ask the social worker. The social worker can provide you with transportation options. They can set you up possibly with your local foundation that may have other options of that sort. You may get discounts, so things like that. Employment, school, social life, those are all questions for the social worker. A lot of people are nervous that, oh my gosh, I have a new diagnosis. Am I going to get fired from my job? We're going to talk about all of these a little later on, but that social work is your go-to. Finances, a really big one is a lot of people can't afford their medications, or the doctor will prescribe a new medication and then they say, wait, but my insurance doesn't cover that. Now what do I do? The doctor means well, but they don't have time to look up the different discounts programs, so social work. Independence as well, that's both a doctor and social work question. The doctor, just because they want to make you seizure free. That's usually the goal, or they want to help you have quality of life. In the meantime, the social worker can help you with resources to help sustain that independence. And then on the right, mental health, that is a big one for social work. Anxiety, depression, stress control, isolation, those are very common with getting a new diagnosis or simply with living with a medical condition, and that's okay. And that's why social workers are out there to help. Next slide, please. So let's backtrack a little bit and just talk about what is social work. As I said, growing up, I know there's stigma about social work. I personally didn't know a lot about social work before I studied it. Social work, I always thought like, oh, that's the child protective services. That's the foster care system when someone comes and takes your kids. That's the stereotype. No, that is one form of social work. But one thing that's very important to know is that almost everyone involved in this field, the goal is to help. And so there's where it says child welfare on here. Yes, there are social workers who will go and remove children from their families if necessary, if that's in the best interest of the child. Usually the main goal is to get the kid back to their family though, so everyone can grow up together. When I was in school studying social work, I was told that there are 3 types of social work. You have micro, meso, and macro. Micro is the one-on-one clinical. That can be therapy, case management, all of that. Meso is community work. You may see social workers at health fairs. You may see walks. We have the walk to end epilepsy around the country. You see the walk for Parkinson's disease, group work, things like that, support groups. That's meso social work. Macro is more research, policy, society changes. There's a lot of advocacy groups out there. You may see protests. You may see people go up to the Capitol, go to DC and try to change a system, try to change policies that impact the system, all for the good and well-being of people. Next slide. Let's see, there we go. So just want to go real quick about what the role of a social worker is. As I explained, there are a ton of different things that a social worker can do. Advocacy is a big part, case management, counseling. A lot of people don't think of social workers as counselors, but a licensed clinical social worker is actually able to run their own private practice for counseling. So if you're ever looking for a counselor, for a therapist, you can look for an LCSW or an LPC, licensed professional counselor. They have many titles, but that is actually a big common role for social workers. Community advocate, education, community education, mediator, so kind of the middleman for group therapy, doing team intervention at medical clinics. They can be a program planner. That's a lot of this is combined in multiple roles. For example, if you work at a nonprofit for the Epilepsy Foundation, I've served as a case manager, an advocate, a community advocate, an educator, a program planner, and the resource person all in one job. And that's what makes it fun. Next slide. So we can get down to the basics here and what happens when you meet with a social worker. That depends on the setting. So as I said, there's different types of social work. Clinical is a doctor's office or a hospital. There's a lot of team intervention during those appointments. As I mentioned, I do have a full-time job now at a primary care physician's office where I am a social worker, and there we have 25 doctors there. And usually how it works, I have my list of patients. I have a caseload of about 100 patients, and I will reach out to them and check in and see what resources they need. But if I haven't met someone before, someone will come to the doctor's office, the doctor will meet with them for the first time, discuss the medical need, then they'll message me or call me and say, Leigh, wait, this person is living in their car. Can you help them? This person can't afford their medications. This person is very depressed and needs some extra support. This person needs assisted living. This person is being bullied at school. How can we work together to help? So that's what would happen in a clinical in a doctor's office or in a hospital. Nonprofit, so with the Epilepsy Foundation is one example. The social workers typically provide case management. You may have experienced this if you ever call the Epilepsy Foundation and say, hey, I need resources. I don't really know what I'm looking for. You're probably speaking with the person who does intakes, who does the information and referral line. That is a form of social work. Therapy is one-on-one support. That's the clinical side. And overall, even though there's so many roles with social work, usually they do the same thing. Usually social workers will conduct a psychosocial assessment, meaning they just want a history. They want to know, okay, tell me more. How can I help you? What's going on? The doctor told me a little bit, or I know we received a referral, but I want to hear your side of it. What are your needs? And then you'll do goal setting. Okay, so I hear that you need rides to appointments. There may be some domestic violence at home right now, or you need to learn more about your medical condition and find a support group. Okay, those are our 4 goals. Let's talk about resources and then see how we can work together on that. Next slide. So I just wanted to give another example of what a day looks like for a social worker. I found this this picture. So I started at the Epilepsy Foundation. I moved out to Denver in 2019. It was August 2019 before the pandemic. And about October, I was sitting in my office at the foundation one day, and my boss came up, said, Leigh, oh, we're having the board meeting in an hour. And can you just tell the board members exactly what you do? You have a new role. We don't really know what you do. They don't know what you do. Just come on, sell yourself. It'll be good. I'm like, okay. And so I said, well, I can show them what I did today. And I wrote down everything I did that day. It's kind of hard to read, so I typed it out. Basically, from 8:30 to 10 a.m., I sent case management emails. I had some people reach out to me, someone who was experiencing suicidal thoughts, someone who needed health insurance, needed some IEP support, meaning some assistance at school. Then from 10:30 to noon, I went to a school and gave a presentation on seizure first aid to 20 students who were learning English. So we kind of did a Spanglish presentation, which was fun. And then came back to the office and did the information and referral line and gave out 3 legal referrals, gave some referrals for support groups. Someone needed some mental health support. Someone wanted to meet another person who has epilepsy. So that's our mentor-mentee program. So with this type of job, it's different every day, which makes it fun. And if you ever wonder, well, can a social worker really help me? Another way to think about it, sometimes I feel like a detective where, okay, I don't have the answer, but let me call my colleague who does, or let me call someone who knows that person who knows that person who, oh, they have the answer. Now we're going to help you. Next slide. So now let's break it down a little bit, just kind of going through the topics. I just want to show you a little more about what kind of support you can get from a social worker. As we said, driving is a sensitive topic with epilepsy. Here, I don't know if you guys have seen this before, there's different maps like this, but this shows the driving laws across the country for individuals with epilepsy. It is different with every state. It's funny, so when I was looking at this, I've lived in multiple states and they all have different rules. So I grew up in Oregon, which says the law is when you have a seizure, that's white, so you have to wait 3 months before you can drive again. I went to college in Washington, which is a light gray, where you have to wait 6 months. I then eventually lived in Chicago and Illinois. So that state and Colorado, both of those states, they don't have a set rule for a timeline on how long you have to wait before you can drive again. It's more up to the doctor. With all of that said, the states have the rules. Again, this is a question for the doctor. Okay, what's your opinion? But it's a case-by-case basis. So talk to your doctor about that. On the social work side with transportation, social workers can definitely help you with that. Obviously, it's harder if you live in a rural area. One thing I was thinking about today, for about 10 years, I was actually unable to drive because of my epilepsy, because of my seizures, and I wanted to be independent. I was like, okay, fine, I'll take the bus, I'll get around, tell me, how can I do that? And I was so excited when my doctor gave me a letter so I could get a discount pass for the bus system in my city, where I only had to pay $25 a month instead of $100. And I was so proud of myself. I'm like, good, I can be independent, I can get around, and I get a discount. Watch this. So even if you can't drive, think of it that way. And then in the end, while you're using the resources and the services, keep talking to your doctor about medications, how you can get to be seizure free, and then driving may be an option in the future. Next slide. Employment. The main question that comes to mind for people with epilepsy and employment is, do I have to tell my boss that I have epilepsy? The answer to that is no. For there is something called the Americans with Disabilities Act, that also known as the ADA. Well, I think we said we're going to send this PowerPoint out later. If I'm wrong on that, just to look up ADA and epilepsy, type that into Google, you will find this website, and it's this article specifically on epilepsy and the Americans with Disabilities Act, and it explains how you do not have to disclose your medical condition to your employer, especially during your interview. Once you get the job, especially if your seizures are uncontrolled, it is useful. Sometimes it is better to tell them what to do when you're having a seizure, so that they can protect you, they can help. And again, they are not allowed to fire you because of that law. Some people get around that and they're dumb and they'll say, oh, well, we're letting you go for another reason. When that happens, call the Epilepsy Foundation or call another organization that provides legal advocacy, and then they will help you with that. A social worker can assist you in finding that. Another thing, askjan.org. I don't know how many of you are aware of this website, but it is fabulous. And it is a website created and supported by the Americans with Disabilities Act. It provides a list of accommodations in the workplace. There's multiple medical conditions listed on there. So you will find seizures / epilepsy, diabetes, cancer. You'll find mental health conditions like bipolar, schizophrenia. And for each condition, it has the list of accommodations that are valuable and would help. If you have something else, if there's another type of accommodation that would be better, you can always have your doctor write a note and then you can give it to your employer. And again, that is supported by the ADA. So you have backup. And if you don't, call a social worker. Next slide. Okay, so school is another tricky topic with a new diagnosis. It can seem overwhelming when you're newly diagnosed with epilepsy and now, oh my gosh, how am I going to get through class? I'm not doing well. Or if it's your kid, same thing. First thing on here, seizure safety plan. That's the most important. If your seizures are uncontrolled and you're in school, the school needs to know what to do. The teachers, the principal, if you're in college, tell your professors, tell your guidance counselor, all of that. They want to look out for your safety. That's important. The Epilepsy Foundation, I'm pretty sure that each one around the country most likely offers seizure first aid training. If you don't have one in your local area and they cannot physically come to your school, they will most likely, since everything webinars, everything is via internet nowadays, they would most likely be able to offer that for you. Also, the National Epilepsy Foundation of America, they have trainings. I think they're every 1 or 2 months. They're 90-minute trainings, and you can get a certification in seizure first aid training, seizure first aid safety. And so that is really helpful. For the next bullet, it says ask about IEPs or a 504 plan accommodations. There are differences between an IEP and 504. I've noticed that since I've lived in different states, it's been interesting. I noticed that in Chicago, when I lived there, the IEP actually seemed like it was for students with more critical needs. And here in Colorado, they said, oh no, that's the 504 plan. Like, okay, wherever you live, either one, ask which plan is better at your school, which one would get you most accommodations, and go from there. At public schools, I'm not sure if I don't think every public school has a social worker, but nowadays there are more, it is common for a lot of public schools to have social workers. They can help you if your child or you need assistance at school, if you need seizure safety planning at school, if you need extra time on tests, if you are impacted by anxiety because of your epilepsy and you need someone with you in class. That's something to talk to the school about. The social worker can help set that up. If you are in a private school, they most likely don't have a social worker there. That would be something to contact the Epilepsy Foundation about, and then they can either help you and kind of help you in those meetings or point you in the right direction of who can. Next slide. Financial concerns. So financial concerns are very, very common for those who go to medical clinics. Even if you have good insurance, you can't always afford your medications because the insurance companies change their rules all the time, and that is not your fault. So it can be beneficial to have a little extra help. First topic, medications. If you can't afford your medications or you don't have insurance, talk to the social worker. GoodRx, I think that's pretty common. I've been seeing more ads about that nowadays. That's a good website to go to. It's just goodrx.com. They have good coupons for generic meds. Needymeds.org is one that's not as well known that I use a lot for my clients, my patients. It's just needymeds.org. You type in the name of your medication, and because GoodRx covers the generic meds, use this one for the brand medication. It doesn't work for every single one, but a lot of them have like 2 or 3 resource options for that medication. And it's usually the pharmaceutical company, and they will have a program where a financial assistance program where they can help you with the cost. I will say one example I always think of, not all insurance types are the same, obviously. So I had Kaiser at one point for insurance, and they would not accept coupons. They wouldn't accept GoodRx coupons, and they didn't cover my medication, Vimpat. I'm sure some of you know what that is. And so the price changed all the time. One time I was charged $1,800 for the Vimpat. Another time I was charged $900. Then they said, oh, this month it's $150. That's not okay. That's not how it's supposed to be. And because they don't accept the GoodRx discount, I'm like, well, I can't afford this. Who can afford this? That's when I reached out to Needy Meds. I reached out to the pharmaceutical company who made that medication, and they were able to help me. So that is one way to do it. Housing with financial concerns, that's a common topic as well. If right now the economy is crazy, things are really expensive, we're all feeling it. If you are having a hard time affording rent, if you are living in your car, contact your county or your local nonprofit. Some nonprofits can offer a 1-month rental assistance. Epilepsy foundations, I know money is a little tight for a lot of nonprofits right now. I know at the Epilepsy Foundation of Colorado and Wyoming, we can't help with rental assistance, but instead we can help with maybe $200 for food, give you a grocery card, and then you can save the rest of the money for rent. So you can go to organizations that can help with that, but definitely reach out to your county for rental support. And then hospital bills, that's a good one to, if you are inpatient, contact the inpatient social worker, ask to meet with them, especially if you're in the EMU or the emergency room and something's going on with your insurance and like, oh my gosh, how am I going to pay for this? It's different every state. I know that in Colorado, there's something called emergency Medicaid. I'm assuming that's in most states. There's different criteria for each one, but ask the social worker about that, and then they can work with the finance department from the hospital. And a lot of hospitals do have financial aid programs that they won't mention unless you ask. Next slide. Mental health, that is a very important one. And like I said, because the world has been so crazy these last few years, it's very important to practice self-care, to get the support that you need. As I mentioned, so LCSWs, licensed clinical social workers, can offer therapy or they can refer out. It can be confusing because, for example, I'm an LCSW. I work in a medical clinic. Even though, yes, I can provide therapy in my role at the foundation and at the clinic, that's not what I do there. So I will refer out. Some epilepsy foundations, they are in contact with psychologists. They can give you referrals for local psychologists. I know at the Foundation of Colorado and Wyoming, we actually train therapists on how to assist individuals with epilepsy, and we kind of give them the seizure first aid training and some basic tips on what to expect and then how to better work with you. And then we have a discount program for individuals who are needing therapy. We'll offer a discount for 8 weeks. So talk to your local foundation about that. You can always go on Psychology Today as well. And then support groups are a really good help, a really good form of assistance as well for individuals experiencing anxiety or depression or isolation or anything from living with epilepsy. The crazy thing about epilepsy is that anxiety and stress are extremely common because a lot of the time that's where, depending what part of your brain is impacted, but that can be triggered by the epilepsy, but also being anxious and feeling stressed out can trigger the seizures. So it's a circle around and around and around. And that's why it's not your fault. You don't have to feel ashamed by that. A lot of people go through that, absolutely. And that's why we have the services to support you, and we want to support you. Next slide. So what other resources exist? As I mentioned, we're talking about the Epilepsy Foundation. There are a lot of epilepsy organizations out there, not only the Epilepsy Foundation. So feel free to just type in epilepsy organization as well, like such as it'syourepilepsy.com. That's a wonderful business. They're helping us. We all support each other. The Chelsea Hutchinson Foundation is another organization. The Danny Digg Foundation in Chicago, they're an organization that provides seizure alert devices. They help with that, just like the Chelsea Hutchinson Foundation. So just look at what's in your area. There's different programs with each organization. Some provide case management, some provide support groups, some have camp. Camp for kids with epilepsy is really valuable. That's really important because kids can meet other kids who experience it and don't feel alone. And now there's also a lot of programs for adults like that as well. There's retreats for adults with medical conditions, including epilepsy. Again, if you don't have a local chapter and you think, well, my doctor's office doesn't have a social worker, there's not a local epilepsy foundation, now what? If you belong to a school, if you have a kid in a school, they may have a social worker there. ask around, hey, I go to this doctor's office, but they don't have a social worker. Does your clinic have a social worker? Or do you know of any organizations that support people with disabilities or have support groups? And just network, ask around, and I'm sure you'll find someone who's willing to help. Next slide. And in the end, the main message here is you don't have to feel like you're alone in navigating the system. If you need education on epilepsy, grief, social support, financial assistance, mental health, advocacy, resources, anything, if you just need to talk to someone and think, I can't do this alone, if you need guidance on Social Security, how to apply for disability, any of that, ask for the social worker. They are here to help. And I think that's all I got.
That was great, Leigh. Thank you so much. We had quite a few great questions come in. So without further ado, I'm just going to start jumping into them. All right, let me pull up my document here. One simple question, well, maybe simple question. Are LCPCs considered a social worker?
That is a good question. They're counselors. That stands for counselors, but they may work in an organization and may have the same role. It just depends what their actual job title is and what they're doing.
Great, thank you so much. So there was a question really at the onset. Wouldn't a psychiatrist also deal with anxiety, depression, stress control, and isolation?
Correct. Psychiatrists can definitely help. One thing with a psychiatrist, so if someone, if a doctor says it would be beneficial for you to find a therapist or a counselor, a psychiatrist is a therapist, but they can prescribe medication. A psychologist or a social worker usually offer more talk therapy. You can definitely go to psychiatry. They usually cost more, honestly, and they might only be with you for 15 minutes, but they are wonderful as well.
And then just to clarify, so I think I heard you saying that there's like so many different types of social worker. There's all these, like you said, there's the LCPC. Can any social worker help with depression? Because I think there are some folks who would appreciate support from a social worker rather than a psychologist.
That's a good question. In order to actually like provide counseling, and if you want to look on Psychology Today and see a social worker who provides counseling, they usually need to have their LCSW, so licensed clinical social worker, and they're the ones who would help with depression. But in a nonprofit setting, you might have people who are right out of college who are getting their experience, and they might not provide individual therapy, but they will still give you resources and maybe do group help with support groups and help with depression in that way.
Thank you so much. So what about, you had mentioned earlier, you know, medications and them being so expensive. And I mean, can you kind of remind us how the social worker can help people get medications that aren't covered by someone's insurance?
So usually what I do, if someone says, I can't afford my medication, the best thing to do is first go on GoodRx and type it in, because that's that's the easiest. Some social workers have colleagues and they know pharmaceutical companies, or they know if they work with a doctor who has ins with different companies. That's where a social worker can come in handy, and they'll call around and say, hey, we found this new program that you can apply for. So that's what a social worker will do in that. If I know that the hardest thing, I have a lot of patients or clients with Medicare, and that's really tricky because they still have to pay, sometimes they still have to pay $80, and that can be a lot of money. That's still a lot of money. And they say in the programs, the discount programs will say, oh, for anyone with commercial insurance, you only have to pay $10. Oh, but if you have Medicaid and Medicare or any type of government insurance, you're on your own. Well, that's not fair either. So ask a social worker, because we intend to find an in for you to help with that.
Great. Thank you so much. So I have actually a couple different scenarios. So I'm wondering what kind of guidance, or just thoughts you could give. So I'm literally just going to read from this person's question. So they've been seizure free for 2.5 years and they had a shunt installed. They've just been weaned off of Keppra and started having mild seizures. They've been letting their doctor know they've been feeling a little weird. The doctor's saying, oh, there's nothing wrong. There's this person is still, yeah, exactly. There's this individual is still taking 2 seizure meds. And then something about withdrawing. I think I may be withdrawing, but no one's telling her anything. So she doesn't know if it's a withdrawal, she or he who posed the question. So yeah, what kind of, what's your support as a
I would say if you've told the doctor this and they're like, oh, you're fine. Sometimes you have to advocate for yourself and say, no, I don't like this. I don't like feeling this way, and make an urgent appointment and say, when can I come in? I want to discuss this. So sometimes you have to be your self-advocate, which I believe in you. You definitely can. It doesn't hurt. You can always get a second opinion if needed to. Sometimes if the doctors are acting that way, some clinics have a nurse hotline, or they'll have they have like a 24/7 rule, and they have a line that you can call and they're supposed to call you back that day. And so maybe the doctor's busy. If you're just messaging them through their portal, just call the office and say, no, I'm actually concerned, I need to speak with my doctor. You can also always call the Epilepsy Foundation of America, has a 24/7 helpline as well. They're technically not supposed to answer medical questions, but they can put you in contact with people who are taking the same medications. And if you want to find support groups while you're waiting to hear back from your doctor, or find ways to talk to other people, that's another way to do it as well.
It's great. Thank you so much. So another one of the kind of scenarios, and unfortunately, I hear this so often, but a parent mentioned that they were trying to get reasonable accommodations, late start for their daughter's start time for school. And she's 10, and they were, because of the seizures, like she needs to be able to, get that sleep, and maybe because of the seizure, she's coming late. So they just asked for extra time in the morning and they were denied. Where do you direct somebody from there?
So I would reach out to your local epilepsy affiliate or chapter, whatever, your local epilepsy foundation. They may have someone on their team who can go to those meetings with you. So I would set up a meeting with the principal, with whoever sets up those types of meetings at the school. So actually before Colorado, I lived in Chicago and worked for the Epilepsy Foundation of Greater Chicago as a case manager. And I would go to those meetings, and we had to meet with the school nurse and the principal and the social worker, who that case manager can bring them the information on the ADA and ask Jan if you need legal representation, more of a legal advocate, not a lawyer, but a little more strong. Ask your local affiliate about that too, because they're a little harder to find, so the foundation wouldn't know that, but there are like disability organizations, and the people are legal advocates, and they do that all the time. They go to IEP meetings all the time. So either ask your local social worker for referrals for IEP specialists, basically, or look up a disability organization, and then that person, that social worker, will help you with that, because no, that's not okay.
Agree, that is not okay. Thank you so much. So next question here. And again, I don't know if this is, I'm learning so much, and I've learned so much about what social workers do and what they can offer. This has been great for me personally. So you tell me how to answer this, but somebody was talking about they're just diagnosed with type 2 diabetes. How would this person's epilepsy and the diabetes impact each other, and where could they go for that kind of answer?
So, and that's the tricky part with social work. Like sometimes we'll get the medical questions, and I always have to say, like, I'm not a doctor, we're not allowed to give the medical requests, but I think a good thing to do would be to make sure both the doctor who helps you with your diabetes and your neurologist know about your two diagnoses, that they're aware, because insulin, other medications that can impact each other. So first, put those two doctors in contact with each other, at least make sure they have your medical records from both sides. And then that actually, I don't know how common it is, but I do know, I have heard that before. I do know other people who have epilepsy and diabetes. I would go find a support group, either honestly an online one may be helpful, and you type that in and you'd be able to find other people with that diagnosis, but start with the doctor, and then it depends what you're looking for. If you're looking for support groups and just trying to figure out, okay, how the heck do I deal with this? You can also casually ask your doctors, do you have other patients with this your neurologist, do you have another patient with diabetes? They're not allowed to obviously give you information, but they say, actually, yes, well, who do they talk to? If there's not a social worker in that clinic, then the doctors may know of the local resources that they give to that person too.
That's great. Thank you. And like you said, I mean, you can't give that medical advice, but that's still really helpful. I mean, really just to tell people, have those two doctors connect and speak to each other. You know, and I think that's a great recommendation I hadn't even thought of, but asking the doctor, like, where's that other, you know, person with maybe my same kind of medical diagnoses, the support. It's great. I think with support groups, actually, since you mentioned that, there was a question about a parent getting their young adult daughter connected with the appropriate support group. She's indicated it's a little awkward, a little strange, you know, trying to get connected to people online. What recommendations do you have? Anything to kind of assist people in advance of virtual support groups or online chat groups, whatever?
Yeah, I definitely understand that too. With the online support groups, I would say it's interesting. Now there's a ton of support groups on Facebook is a good way to find it. I was thinking about this the other day. I actually, and I met someone through an online epilepsy support group about 10 years ago now, and she and I have been emailing each other for 10 years. We had the same brain surgery, and we both said, she said, oh, I had this type of surgery. I'm like, wait, I did too. And I emailed her, and 10 years, it's the same email thread. We've gone back and forth. And it was some random Facebook epilepsy group. Like, that's one way to do it. With young adults, it can be hard because if she's interested, that's amazing. Sometimes they're like, no, I'm fine. I don't want to talk about it. There are a lot, it depends on the affiliate, on the chapter of the foundation, but there are a lot of foundations that have young adult support groups, whether that's 15 to 25. I know that we have that here at the Foundation of Colorado and Wyoming, and we're actually having a young adult retreat for individuals with epilepsy in their 20s. So maybe ask around for that, and in your area, it's amazing what you find in different towns and cities, like, oh, well, that doesn't exist. Wait, you guys do that there? Really? So you may have something that we haven't thought of here. So I would just say keep asking around. You can do the online stuff, but look for in-person too, if she's up for that, and look for a retreat, like a weekend retreat, or there's sports programs for individuals with neurological conditions. You may find something like that. So just networking.
That's great. All right, let's see. we still have time. So I've got some questions specific around transportation. So the first one might be an easy yes, no, but so if the doctor, actually it's probably not because it's related to driving, but if the doctor tells me that I cannot drive, can I ask him to refer me to a social worker to help me with transportation? I think you had kind of broached this earlier, but elaborate if necessary.
Yes, absolutely. That is That's exactly what you should do. Ask to speak with a social worker for transportation options, transportation discount options, and then also ask your doctor if they do know of a program and the social worker might refer you to this. Some programs, depending on your age, might want the doctor to write a letter explaining your diagnosis, stating why you can't drive. So that's where the doctor and social worker work together. But yes, ask about all the discount options with the social worker and they will help you out.
Thanks. And I'll note just being in Los Angeles and being from California, California is one of the few states that still has the mandatory reporting of any lapse of consciousness. So I know that there can be, and so I can really speak from the California perspective, knowing that more intimately. But you know, it's definitely, sometimes you need that legal advice too. So, you know, I definitely, as we've mentioned many times, reach out to your local organizations. And as I put in the chat on it'sYourEpilepsy.com, they have a great link for community partners beyond the Epilepsy Foundation, but also some of the partners that have supported this webinar. The Danny Diggs of the world too. So please always reach out as well. Let's see. Okay, transportation. Let's see. On what basis does your doctor recommend license reinstatement? Do you have any thoughts about that, or does that get into kind of the weeds of the medical advice?
Sorry, on what basis? Sorry, read that one more time.
On what basis does your doctor recommend license reinstatement?
Yeah, that is more of the medical question. It goes with what your doctor believes is safe for you. Typically, the goal is for someone to be seizure-free to drive, but I do know that with certain seizure types, someone is able to drive if they have an aura beforehand, but that goes with the doctor and they need to give you guidance on that.
And to make it so much more complicated too, like you noted, every state has different rules as well. So those definitely will influence what the doctor can do as well. I hadn't heard of driver rehab use, but they're mentioning something about driver rehab. I don't know if you're familiar with that. And
I actually am not. That's interesting.
Well, the person who added that question, actually, if you could share in the chat with the panelists what that is, I'm really curious. And if we can identify some resources, we can share those with folks afterwards. And that same person also asked about connecting them to research and making recommendations for more evidence-based than a medical opinion when your meds have your seizures controlled. So we'll try to identify some resources for that we can share with folks afterwards. All right, so that kind of goes through the questions that I had that I picked up before, but let me jump into the chat real quick just to see. Great, somebody mentioned the young adult retreat happening, as you mentioned that, Leigh. Somebody's mentioning Lyft, trying to make appointments early in the morning. This is back to the driving tip. As bus systems become a regular afternoon. Eastern Pennsylvania also has a young adult retreat.
Wonderful.
Yeah, and let me see. I think there was, let's see, either way. Yeah, I think that about does it. I think there were some other great tips some folks have dropped into the chat, and we'll try to put those together and follow up with folks as well. So any last questions? Asking the folks online, going once and twice. All right. Okay. So I'm going to actually start off by thanking the Chelsea Hutchison. I'm saying that I'm adding an N to whoever corrected me. Apologies. For some reason, my mouth is just stumbling over that today. And they're a fantastic organization. We've actually referred a lot of our folks to that foundation. And of course, thank you to the Pediatric Epilepsy Surgery Alliance. And we've got, of course, again, all the resources. it'sYourEpilepsy.com, which is also where the recording will be posted. There will be at the very least some key takeaways that will be shared with folks. We also will be maybe sharing a survey too, just asking you what you would like to hear of in future webinars, and any kind of feedback about even today too, we would love. And then of course, there were multiple epilepsy foundations too. My office here in LA, Eastern Pennsylvania, Colorado, Wyoming, Minnesota. And then last but not least, thank you, Leigh.
Thank you. And I have my email up there if anyone has any questions, especially if you live in Colorado or Wyoming, which are the states that this foundation supports. I am happy to help in any way that I can.
Thank you so much. All right, everybody take care, and we hope to see you next time.